nutrition here in New South Wales. Can I begin by thanking all our health staff right across the state who are working tirelessly day in, day out to keep the people of New South Wales safe. So on behalf of everyone right across New South Wales, can I thank our doctors, our nurses, our paramedics, those on the 000 call lines who are working enormously to make sure we get through this challenging time. And I just want to thank them particularly today for everything they've done over the last 2 years, but also as we move through what will be a difficult few weeks here in New South Wales. Well, today we commence here in our state the rollout of vaccinations for our 5 to 11-year-olds. And that will occur in GPs, pharmacists, and many of our hubs right across our state. We here in New South Wales want to particularly support that system as we move through. We appreciate that and acknowledge that vaccination has been key to keeping our community safe, and the efforts that people have made right across our state during this vaccination program has ensured that New South Wales is in a particularly strong position to deal with this phenomena, this global phenomena, and vaccinations and now boosters have been key to that. As a parent, I know it can be daunting getting your children vaccinated. We had our daughter just last week being vaccinated in preschool, and I think she's screamed the GP centre down. But what I know here with our hubs that we're supporting that GP network here in New South Wales is that it's a very kid-friendly environment, highly supportive to ensure there's as much comfort for parents, anxious parents and children as we go through this period. But we know that the vaccination and our booster program has been incredibly well run, both with the Commonwealth and the state governments working together, and I know that we'll get through this rollout well as we have in the past. On our vaccination rates here in New South Wales, I'd like to point out that on a first dose vaccination at 95.1%, a double dose vaccination at 93.7%. These numbers are incredibly pleasing. On the booster shot program, in the last 24 hours, 10,000 booster shots in our own clinics, and that's 100,000 over the course of the week. Can I encourage everybody across the state, if you received the first dose vaccination, please go and get that second dose vaccination. We want to get that up to well above 95%. And in relation to that booster program, we know that boosters work. And so many of our clinics have walk-in opportunities. Please find the time. We know that boosters are key to keeping you, your friends and your family safe. And that's what we've seen over the course of this period of time. And if I look at the ICU numbers today in New South Wales, 159 people in ICU, half are unvaccinated. And that is at a time we have a 95% vaccination rate here in New South Wales. The numbers don't lie. The best way of staying safe, keeping safe, is getting boosted. That's been the strength in our state over the course of the last 6 months. We never believed we'd get to that strong position, but we are here because of the efforts and the sacrifices that people have made right across New South Wales. So as we move through what will be a difficult few weeks for our state and around the country, I know New South Wales is in a very strong position because of the efforts that people have made right across our state. Can I say continue to treat everybody with kindness and respect. That's what's got us through over the last 2 years, and that will get us through this next challenging few weeks as well. I'm now going to pass to Dr. Kerry Chant, who will give a public health update. Then Susan Pearce will provide some information in relation to the booster shot rollout and the vaccination program, as well as we move through to 5 and 11-year-olds today. And then Dr. O'Mara will also provide some information in relation to the vaccination rollout for 5 to 11-year-olds.
So today we have around 2,030 COVID cases admitted to hospital, with 150 people in intensive care, 47 of whom require ventilation. There were 20,030 cases detected by PCR testing reported in New South Wales to the 24 hours to 8 p.m. last night, and 84,000 PCR tests were reported in that period. Now that clearly is an underestimate as people are moving and transitioning to RAT testing, the rapid antigen testing. And but just to let you know that that's certainly hopefully freeing up quite a lot of our capacity for PCR testing for those that need it. And if you cannot access a rapid antigen test and need to be tested, please proceed to get a PCR test. One of the key issues, we just want people to be linked with care. So if you fall into the categories where you're unvaccinated, you're pregnant, you have chronic underlying medical conditions, please don't delay getting a COVID diagnosis. It is critical that you are linked with care. And also, please, a reminder, do not take symptoms such as breathlessness, particularly in young people when that is not your underlying usual condition, without taking that very seriously. And I think you've heard before from some of our intensivists and respiratory physicians that we don't expect young people to get breathless or dizzy, and that's a sign that you really need to escalate your care. Sadly, we're announcing the deaths of 18 people, 6 women, 11 men and a child aged under 5. And the child from southwestern Sydney died at home and had significant underlying health conditions. And a man from his 30s from eastern Sydney died at Prince of Wales Hospital. Can I just express my sincere condolences for those that have lost their loved ones. As we go out and about, can I just remind people of some of the public health orders that are in place? Please continue to wear those masks indoors. Please continue to work from home where that's practical. Please also take those reasonable steps to limit your interactions within your to broader social networks. So keep those household gatherings in smaller than you'd normally have. And also choose to go outdoors. I'm a bit sad to hear that we're going to have rain this week, but please use all of those outdoor spaces, verandas, other areas of your house. Keep your house windows open as much as you can. These simple measures can really help us slow the rate of transmission of COVID, and that is important to just reduce that burden on our health system and also our critical infrastructure that we need to be maintained at this time. Thank you.
Thank you. It's great to be here today for the next stage of our vaccine rollout in New South Wales, and we have performed a lot of vaccines in this state to support GP and pharmacy colleagues. This will be no different. For the 12 to 15-year-olds, we saw a really rapid uptake in vaccination. We'd like to see more kids in that age group come forward now as well. We expect to see the same for our 5 to 11-year-olds. And I know that we already have 63,000 bookings across New South Wales health clinics for children in that age group. We still have bookings available at a number of our clinics, and we'd encourage everybody who hasn't made a booking for their child in that age group to make one as soon as possible. Please be patient. We are certainly doing our best to support the Commonwealth in respect to that rollout of vaccination for our kids, and we'll continue to do that. Most of our clinics have provided nice spaces for children to be vaccinated. Here at the Children's Hospital, obviously, that will be exceptional, I'm sure, and we're trying to make it as comfortable for the kids as we possibly can. As the Premier said last week, we performed over 100,000 boosters across our clinics in New South Wales health clinics, noting that Monday last week was a public holiday, so it was a bit of a lighter day than some of the other days. This week we expect to see that number to continue to grow, and I know that there is a lot of interest amongst our community in getting that booster dose. In respect to our hospitals at the moment and our health services, we're obviously watching that very closely, working through the weekend with our chief executives. Today we expect to start to see some patients making their way to private hospitals where pressure on the hospital beds is such that they need to do that. We do still have a number of staff furloughed at the moment, and so often it's not so much an issue of beds, it's an issue of staffing those beds. And we continue to watch that and monitor it every single day. But it is only thanks to the efforts of our extraordinary staff that we continue to manage. In my view, they are managing this exceptionally well at the moment, and we'll keep working as much as we can to make sure that we reduce as much pressure as we can on our hospital system. To echo Kerry's comments, though, if you are breathless, if you need to come to the emergency department, please do not delay that. We really should encourage people to watch for those signals. Thank you.
Good morning. From today, Children aged 5 to 11 will be starting to get their first doses of the Pfizer COVID-19 vaccine. Getting the vaccine is a safe and effective way of protecting your child. As you've heard, 63,000 children have already been booked in to New South Wales health vaccine clinics. Many more. In fact, the majority are going to get their vaccines through their local GP or their local pharmacy. You can see where to get your child vaccinated through the Vaccine Clinic Finder. Just book in. I acknowledge some children who have been booked in for vaccines through their GP or pharmacy have had their appointments cancelled. There have been problems due to supply chain and due to staff illness, just like other vital industries. I know that delay can be really frustrating as you've tried so hard to protect your child as soon as possible. I appreciate your understanding and your patience. The interval between the 2 doses is 8 weeks, so children who get their first vaccine today will be eligible for their second vaccine in early March. That 8-week interval means that more children will be able to get their first dose of vaccine even sooner. Thank you.
Questions? Private hospitals now. Were they people that should be going to public now?
Susan.
Can you just explain a bit?
No. So what happens is on a hospital to hospital basis, the capacity on any given day can be such that they need to move some people across to the private. That's how we have been operating throughout the pandemic and even during the Delta phase. So the hospital will make an assessment. It's not something that you do lightly. For example, there's a fine balance about how we manage our hospital beds, and so what we do is we assess how many people we think will come in on any given day, what the discharges look like on any given day, and if we're finding that that there are more people than beds available, for example, that would be an opportunity to move some of our patients across to the private hospitals. The reduction in elective surgery means that capacity, both in our hospitals and in the private hospitals, exists. So it's a very sensible approach to move people rather than waiting till the hospital exceeds its capacity and then you have problems in the emergency department that backlog into our ambulance service. So it's a preemptive and proactive measure to be able to deal with demand on our hospitals.
So what are some of the pinch points then? What hospitals are we seeing this happening at?
Look, this fluctuates right across the state. So at the and as I said, during Delta, the same thing applied. So some of our Western Sydney hospitals, for example, would use beds in some of the private hospitals in their surrounds. I know talking to Nepean over the weekend, they were looking at moving some patients across today. Can I restate, this should not be seen as a failure of the public hospital system. It is a planned exercise. We've been open about the fact that we intended to do this. And as I said, it is not a large number, but it is enough to help take the pressure off some of our hospitals at the moment.
Just some numbers though, how many staff have you currently got furloughed across the state?
I haven't got today's numbers.
And how many patients have been moved into the private?
Look, we're talking about in the tens of patients, not hundreds at this stage. So it's, even at Nepean on the weekend, it was 12 or 16, not a large number. But just enough to create that capacity. We're talking about often, and on this campus in particular, if you can imagine, where you've got Prince of Wales Private, Prince of Wales Hospital, often our private hospitals, fortunately, are quite closely co-located with our public hospitals. It makes it somewhat easy to do that. But we're in constant discussion with our private hospital colleagues. Can I thank them for their support and effort as well during this time, as well as their staff.
And apart from Nepean, what other hospitals is this?
Look, I'm not prepared to go through on a case-by-case basis of every single hospital, but this is the plan for all of our major metropolitan hospitals. On the weekend also, for example, Westmead was able to move some patients across to Royal North Shore because they had some more capacity. We've been doing this for months, and particularly during the Delta outbreak. So these are often just general ward patients, not ICU. We have overall still capacity across our hospital system, but it is just this, it's a relief valve that exists, and it is the way we will continue to manage through these next several weeks.
Are some public hospital wards, not ICU, are ICU wards in any public hospitals full at this stage?
Look, our ICUs, particularly in Western Sydney and southwestern Sydney, have got quite a lot of patients there, both COVID and non-COVID. At the moment, though, our ICU numbers are well within capacity, but that is not to say that there's not pressure in those ICU beds. I think last night, it was around 470 ICU beds were occupied overall. That's the entire number, not COVID. And so obviously that's well within the capacity of our ICU network. But, again, we monitor this constantly, and I mean constantly, and we're aiming to support our staff to get through this. Some of the other measures that we're taking that we mentioned last week with the ambulance service, for example, when the ambulance service attends a patient in the community, we want to make sure that if possible, and if your hospital is under pressure, we actually might move a patient from one part of Sydney to another part so that we get them in the right place first go rather than having to move them later. Again, we did this through Delta. It worked very well. Our hospital system appreciates that effort, and the ambulance service is also well engaged with expert medical staff who are calling people rather than sending paramedic crews to pick them up. They have saved significant numbers of transports safely and appropriately through that model, and we'll continue to do that as well.
Can I ask you, you've obviously called for people who are at risk to make themselves known and reach out as soon as possible. We've heard yesterday from people who are immunocompromised who haven't had any contact with New South Wales Health and really should have. How widespread is that kind of an issue? Are you worried that there are people out there who are falling through the cracks?
Well, clearly I worry that people do fall through the cracks, and that's why we have been doing the work that we've been doing to make sure there's call lines, working with our GP colleagues and trying to get as much information out there that there are groups where there are therapies that are time critical. The other thing that we want people to do is present early, so not wait for them to be 6 or 7 days into their illness before they seek testing. That often means that the window of opportunity for some of the therapies is diminished. So I think I'd just like to acknowledge the role that GPs are playing in supporting their patients. Pharmacists are fantastic as a point of call as well, and our call lines. But I do acknowledge the challenges of communicating effectively with everyone. We're doing a lot of work with the multicultural communities to get some of these messages out more effectively. But it is something that I want to reiterate, because the key issue at the moment is I don't want people missing out on therapies when they could have benefited from those therapies.
On that issue of the call lines, doctors, particularly in Western Sydney, the Western Sydney Local Health District, are saying they're complaining that they're put on the same COVID support line as everyone else, and it's taking hours to get through. Is that call line overwhelmed? Is it resourced enough?
Look, I'd be happy to follow that up with my colleagues and get the. But I know that the issue of making sure that GPs had prompt access to that clinic to escalate clinical issues has been being dealt with, and it's been done and monitored. I mean, we really appreciate the role that GPs have played in supporting their patients. That's what usually happens, but clearly in this setting of a large number of patients. But it has been a priority for us, and my colleagues in New South Wales Health have been working to ensure there is that ability for GPs to escalate in a timely manner.
Dr.
Was he vaccinated and did he have any underlying conditions?
The gentleman in his 30s was not vaccinated, and in terms of underlying health conditions, I really haven't been briefed adequately, and not all health conditions you'd expect to lead to that, so I just haven't got that information available. I think I'm just highlighting the key points, that we know that vaccination is going to help us. We know that with Omicron, having that booster is going to be really critical. And I do want to urge everyone, particularly elderly or those with chronic underlying health conditions, to get into the boosters. I'm also expressing, asking the community to be understanding if they're saying, if GPs are prioritising some of those most at-risk patients or at-risk children ahead of others, and if the community could just understand that at this time it is a greater benefit if we can get all of those particular members of the community that are at risk boosted. And then the other component is just, as I've indicated in my beginning section, is we really just need to make sure people are aware that symptoms like breathlessness, dizziness, I think in the Delta wave we had a big push around don't recognise the symptoms of deterioration, reach out for help. These are all messages that we want to get out to the community.
Dr. Chant, breathlessness and dizziness, faintness, is that called 000, or is that ring and sit on hold with the helpline?
I think seek care immediate, as soon as possible. I mean, if you're not normally breathlessness in a young person, as I understand it, and I haven't practiced clinical medicine for many years, but I think it's a very key signal. And also dizziness. I mean, I was here when our respiratory colleagues and intensivists were talking about the fact that these are early warning signals that you need to escalate care. So seek advice immediately and ring 000 if your breathlessness is not, if there's been a change in your normal level of breathlessness.
Are there any pathways for at-risk children to be fast-tracked?
I think I'll defer that to my colleague, the chief paediatrician.
Sure, tell me.
So are there any fast-tracking pathways for kids who are immunocompromised to get the vaccines? We have the 5-year-old who died.
There are. So while the vaccine centres are taking bookings from everyone, there are ways for children who are particularly vulnerable to get their vaccines with a priority. The specialty teams that normally care for those children are managing that and are able to make sure those children are prioritised for their vaccines.
Premier, can we ask you about...
With the recent deaths, do we know if they were Omicron or Delta? Do you have that breakdown?
There's obviously a little bit of a delay in the sequencing, but we are we are monitoring that, and in the epi report we will report it. I can confirm that some of the deaths in younger people have been, I'm aware, were associated with Omicron, but I haven't got a line-by-line listing of all the deaths. And that may not be the priority for us at this time, but we do know that some of that one of the cases was associated with Omicron, the death of a young person.
Why is it that the vaccination status of those who sadly pass away with the virus is not being revealed daily?
I suppose it's also just around the fact that we will collectively report the vaccination status for individuals. I would like to say to the community to expect that increasingly that there will be elderly people that are doubly vaxxed and also boosted that die. Many of those have got pre-existing health conditions. I suppose we're also balancing the issue that, so we will be collating the information and presenting it, but also we just want a process where we work with families to let them know what information is being released. So that, and also when we're releasing this information, we're really not making any judgment, and I think that's really important. We're just urging everyone who is not vaccinated to come forth. But as we go forward, we should expect, because most people are vaccinated, to see an increasing proportion of people in ICU that are vaccinated, and we will always tragically have deaths, sometimes with or because COVID may have hastened the death in people that are near end of life. And we're attempting to refine the way we present that data in the epidemiological report so that people get a better balance of those circumstances so they can assess for themselves the impact of COVID.
Premier, just the isolation exemption situation. There's a call today from people within the hospitality industry for that exemption to be extended to them. Is that something that you will consider?
Look, as we move through this next phase of the pandemic, we are constantly monitoring the situation and making adjustments as we see fit. Obviously, when it comes to food distribution and manufacturing networks that are essential, just like during the lockdown period, we made those exemptions at that time. But as we move through, changes will get made along the way. I understand completely where the hospitality sector is coming from. Even before the outbreak of Omicron, we've had right across the board significant staff shortages in a number of industries. And we want to obviously continue to deal with those as we go through. We'll work with our health teams in relation to that. but we need to prioritise here, and ultimately our number one responsibility is to keep people safe. But as we move through this period, I would expect further adjustments will get made, as we have from time to time. But obviously we've been in contact with the hospitality industry, completely understand their concerns. Better to be open and have this issue, as I've said in the past, better to have the issue of labour shortages than be closed. But we'll move through. I'll continue to have discussions with them and work with our health teams. But at this stage, we are completely focused on ensuring that those essential workers in those areas of food supply and manufacturing distribution networks have the labour force required to keep society moving through.
On that food chain, though, are you looking at making those rapid antigen tests that you're starting to receive delivery of available to private companies within those essential food chain supply chains?
Look, we're working through those issues now. Our number one priority is to use the rapid antigen tests that we have procured from a state-based level in those areas such as schools, such as social housing, vulnerable communities, Indigenous communities. We've already started that program of bringing out those rapid antigen tests into regional and remote communities. That's our focus. We're working through that distribution at the moment. But ultimately as well, what you'll see as we move through is a substantial amount of supply being available through private supply chains as well. And in addition to that, as other state governments, we'll be working very closely with the Commonwealth government, so we're complementary. I mean, they've procured or set out orders for 70 million rapid antigen tests. We have set out, we've purchased 50 million. We'll be purchasing an additional 50 million more. What's most important is this collaboration between levels of government so that those who need those tests get them.
So if a company is running a logistics business, you've said that their workers can go back to work provided they do a daily wrap. Yeah. What if they can't get a wrap?
Well, we've been working very closely with the employers. So what you'll see in those situations is that the employee is only given that exemption in circumstances where the employer has indicated they need that worker at work. So in those circumstances, the employer, who we've been working very closely with, will be providing those tests. If there are ways in which we can support that, we will. Whether that's, as we say, whether it's vaccinations, boosters, the state government is here to provide any support that we can, whether that's supporting vaccination rollouts for young kids, which obviously GPs will do the main. Whatever we can do to assist, we will.
But you're not going to hand over your rats to them?
No, we're in we've been in discussions with them in relation to this process. If there is a requirement, we will certainly look at it. But ultimately, right now, where the government is focused on is ensuring that the rapid antigen tests that we've procured go to those essential services from the state government level, schools, social housing, protecting vulnerable communities. That's our focus. But as we said, as we move through this, if changes need to be made, we will, and work very closely to make sure that those who need a rapid antigen test get one in circumstances where they are at work and are required to be at work to keep distribution networks moving.
So how far down your priority list is the hospitality sector now when it comes to exemptions? Is this something we're probably going to look at more February, like after the peak?
Well, Tom, we'll look at this on a case-by-case basis. Ultimately, we are focused on essential workers at the moment. That is our key focus here in our state. And naturally, when exemptions get made, your door gets knocked on for further exemptions to be made, and that's just natural, and I accept that. But it's all about the balancing of risk and having society, obviously functioning well. We struggle, we had the same challenges during the lockdown periods with essential workers, particularly in Western Sydney. We made changes at that point in time. Where we can make changes, we will, but that has to be balanced with the health risk associated with that. So understand the concerns of the hospitality industry, and it's not just the hospitality industry, it's right across the board. Obviously, as the case numbers increase, more people are in isolation. That is a difficulty, but it's not just unique to New South Wales, it's right across the board. We'll manage that as we move through, and if there is a need that we can make some changes in a proportionate way, we will. But at the moment, the change we made yesterday is clearly focused on those essential services and distribution networks.
Do you see a time in 2022 where most people exposed in close contact to the virus are not meeting to isolate this year?
Well, that's really a matter for our health teams as we move through the pandemic. If we've learned anything over the last 2 years, we don't know what curveballs COVID will throw at us, and there'll be other challenges as well. I would expect as we move, we'll get complete confidence we are going to get through, our state will get through, like we have over the last 2 years, this wave. And when you're in the moment, when you're in the wave, it can be tough. But our people have stood tall over the last 2 years and are standing tall now, and will come out stronger the other side. But that doesn't mean when we get through this, other issues won't come our way. And when they come our way, we assess the situation, we look at the evidence, and if we need to make changes, we will.
Can you explain, Dr. O'Meara, that some parents have had trouble getting vaccine appointments or had them cancelled? Is there anything more that can be done to fix this issue?
Well, obviously at this time of year, it's difficult for GPs because many are on leave, but there's mixed stories here. There's mixed stories. I mean, I heard yesterday that people were struggling to get access to booster shots, but then I heard many people were walking into the Homebush Vaccination Centre and receiving a booster shot. So there are many avenues available. I was speaking to somebody this morning who made a booking just yesterday for their child to be vaccinated and received an appointment tomorrow. So what we're doing from a New South Wales government perspective through many of our hubs is supporting that GP and pharmacist network. There will always be, as I said, bumps along the way. Nothing's perfect in a pandemic, but working together with the Commonwealth Government, we believe we'll have the systems in place to roll out this vaccination program just as well as we've rolled out the other ones. Let's not forget, here in New South Wales, we have the highest vaccination rate as a state in the country. And, in terms of world numbers, New South Wales leads the way. So that's a great sign of success. And that's levels of government working with GPs, pharmacists, and the people of our state to do that. So we should actually be very proud of what we've achieved as a state in relation to that vaccination program. When you look at the challenges globally, what is very clear is that lower death rates come from higher vaccination rates, and that's what we've achieved in New South Wales.
Can you explain the registration system, this act you're looking at for schools, for their rapid tests?
So
the application where parents can upload their negative rapid tests.
Well, we haven't released, so in terms of schools, we haven't released, and we are finalising our return to school program.
Well, someone's let the cat out of the bag, Premier, because it's in the newspaper.
Well, I know, and as a parent myself, there is a lot of interest in getting kids back into the classroom, and but we will release our plans when they've been finalised and have been approved through the COVID and Economic Recovery Committee.
Timeline for that, because the clock is ticking.
Yeah, absolutely, it is ticking, and that's why there'll be a discussion at National Cabinet. I certainly believe, if possible, we should agree to national principles. I think that if the country moves together as one, that's best. But ultimately, we will look at the challenges that are in front of us. We're working through that with New South Wales Health and with the Department of Education at the moment, and we're very confident that we will achieve it. As the World Health Organisation has said, schools should be the first to open and the last to close. And we're committed to that.
The company that is involved in helping you achieve this aim has seemingly revealed many of the details already, saying there will be a test-to-stay policy. Is that right?
There's been no government decision. So when a government makes a decision, then it becomes the policy of the government.
Have you signed a contract with Pfizer?
No, the Department of Education obviously is working through those plans. And we are in the process of finalising those plans. We're working very closely with New South Wales Health in relation to that. But it doesn't become government policy until the government actually makes a decision. And I understand that there's a lot of interest in the media in relation to return to schools. We're committed to getting kids back in the classroom on day one. It's the best thing for kids. It's the best thing for parents. We've had so many children, particularly young children, lose a quarter of their schooling. The impacts on a child's life as a result of losing many days in the classroom can have significant impacts. So we're moving through the pandemic. We want kids back in the classroom that's in an environment that's safe for kids, safe for parents. We're working through those options. We'll go to National Cabinet later this week. If we can reach national agreement in relation to those principles, I think that would be best. Ultimately, there are some similar principles, and I accept that different states are in different positions. Obviously, down New South Wales and Victoria in a very similar position in relation to the pandemic, very different to Western Australia. So there'll be different needs at different times as we move through the schooling year. But last year, we got kids back into the classroom earlier. Now, wasn't perfect, accept that. Some schools had to close, but ultimately we want to keep parents and kids safe. But in the main, we had kids back in the classroom towards the back end of the year, and that's incredibly, incredibly important.
Premier, you say there's a lot of interest in the media in return to school. I think with respect it's being driven by interest from parents in return to school plans.
Yeah.
The clock is ticking, 3 weeks to go. Parents are trying to make decisions whether or not they will feel safe sending their children to school. If they're not, they'll need to make care arrangements.
Yeah.
So why can't you at least tell us what you're thinking the plan will be at this point?
I'm not giving a running commentary in relation to those plans. What I have said over the last few days is that we are completely committed to getting kids back in the classroom, day one, term one, in a safe environment.
But how can you do that? Because you will have close contacts left, right and centre. You'll have teachers who will be off contracting the virus, close contacts themselves. Is it going to be possible?
And that's all been worked in. That's all been worked in as part of the plans, just like we're seeing with the health system. Just like in relation to your earlier question with respect to hospitality. There is clearly going to be bumps along the road. But the alternative is to close. And that's not what we're doing. What we want to do is ensure that we have kids back in the classroom, day one, term one, in a safe environment. Health is working very closely with the Department of Education. As soon as we have those plans, rather than give a running commentary, as soon as we have those plans, we will release those plans.
Can you give a commitment on when you will release those plans?
I said we're in National Cabinet this week, and as soon as those principles are finalised, and as I said, my view is that that National Cabinet reaches an agreement this week in relation to it. That's what's on the agenda, and that would be my expectation. Now, ultimately, if that is not what is achieved at National Cabinet, well, we'll look at our own approach. But ultimately, we have plans in place here for New South Wales. We're finalising that position. We absolutely want to give certainty to parents. We want to get.
People who've tested positive on rapid antigen tests right now do not have any legal obligations to report that. Will you amend public health orders to change that, and are you finalising your penalties?
Sorry, say that again.
So for people who test positive on a RAT test, right now there are no obligations legally for them to report that. So
yes.
Have you finalised the penalties, and will you amend the public health order to reflect that?
Yes, so we will have something to say about that later this week. Obviously, by midweek, I'm advised by New South Wales Health and Service New South Wales that we will have a system in place which allows people to register their positive RAT test and connect through to health. And we've made the decision as a government that we will mandate that requirement. Now, once we make that announcement later in the week, we'll set that all out for you. Serena then Tom.
Sorry, I'll go on to Dr. Chant, if that's all right. Carbon dioxide monitors, are they effective? Should we be looking at them to fight?
So Education's done an extensive piece of work last year associated with the Delta outbreak and preparing schools in terms of ventilation, because what you're using carbon dioxide monitors for is an indicator of ventilation. So it would be best to draw those comments to them, but they've extensively covered this important issue of ventilation, and I can't stress the importance of trying to maintain ventilation, keep windows and doors open, and ensure that you've got that free flow of air.
Just on, Dr. Chant or Dr. O'Hara, just on kids that have contracted COVID, is it the same wait time before they can get vaccinated as adults? How long do they have to wait until they can get vaccinated if they've contracted it recently?
It's the same.
Okay, cool. And supply...
What is that number, sorry?
After getting COVID, usually 1 month is the usual period. We certainly want them to be over their symptoms, so 1 month and over all your symptoms.
And you're comfortable with the supply at the moment of vaccines for this new age group?
At the moment, yep, that's, I'm told reliably that the supply is sufficient.
Thanks, everyone.
Thank you.